Yes, welcome to the show once again. Like we take talk few minutes ago, say Dr. Bat go dey in the building with us. We're going to talk about things we get to do with health, any kind thing as far as health they related to them. You feel free ask question on top of this show because the person who will carry concern now bunge doctor na him be certified one as at that if you ask me. And as you take note every Saturday, we will come out one topic we get to do with health. Tabi inside Health Matta come pieces for una understanding. Dr. Bat, good morning, sir.
Good morning, Chief.
How you doing, sir?
I'm good. And you?
I'm fine.
Thank you very much for your kind words.
Doctor. Good morning, sir.
Good morning, ma. Okay. Good morning, viewers at home and around the world. This morning we'll be looking at yet another new topic. My name is Dr. Bath Ufebunam. I'm the Medical Director of Grace Valley Medical Center here in Lagos. And this morning, we'll be looking at a very important topic that concerns we. When I talk about we, I mean the men's folk. The month of June is actually the month for men's health. And this morning, we'll be looking at erectile dysfunction. Erectile dysfunction, otherwise known as impotence. That's a way a layman can understand it. Okay, so they're about the same thing. It's just the use of words. Okay, well, before we go into that, I want us to look at the introduction. Number one, we'll give a definition. We'll look at the anatomy of the male reproductive system. We look at the anatomy of erection. We look at the signs and symptoms, the presentations. We look at the diagnosis, prevention, risk factors, treatment, if we have the time today. Okay, so I want us to start with the anatomy. Now, the penis is a male sex organ, which every man ideally should have, except in situation where you have a congenital malformation. Okay? The penis, we all know what it is. Okay? Essentially, it contains, talking about the anatomy of erection now, essentially it contains three important columns. Of course, the penis contains the shaft, the glans penis, as well as the scrotum, in which you have the testicle, the two testicles, okay? Or the testes, if you like. Now, the anatomy of erection has to do with a very important three columns that are found in the penile shaft. What are they? They're called, number one, corpora cavernosa. There are two spongy tissues that are found in the penile shaft. The one that makes up the third component of the three columns is called corpus spongiosum. Corpus spongiosum. Okay? The other one is corpus cavernosa because there are two. Now, this corpus cavernosa contain erectile tissues, contain nerves, blood vessels, by that I mean veins and arteries, contain nerve endings, contain lymphatics as well, and as well as other tissues. The corpus spongiosum, which usually is at the ventral surface of the shaft, we're going to see some pictures so that it will enable us to understand the things I'm talking about so that we don't just sound Greek. Now, the corpus spongiosum usually is found underneath, while the cavernosa are found on either side of it. The corpus spongiosum transmits the urethra, which of course is the pipe that transmits urine, as well as for ejaculation during the process of sexual intercourse. Okay? Now, these columns are covered in a dense fibrous tissue that is called tunica albuginea. Okay? Now, what happens during the erection is there's a complex network that usually involves the psychological, the neural, the endocrine, as well as the vascular components. Okay? The psychological, it has to do with your visuals. It has to do with what you can feel. Okay? Now, this will bring about stimulation. Okay? This stimulation will send chemical messages to the nerves all the way through the brain. And of course, there will be feedback that will bring about secretion of a vasodilator component known as nitric oxide that causes vasodilation of the vessels that permeate this penile shaft. Talking about blood vessels. So what happens is that the arteries open up and there's a rush of blood into the penis. At the same time, simultaneously, the venous return is blocked. Okay? In the sense that the blood keeps pushing in but cannot go out. Now, this arrangement will bring about stiffness of the penis, which of course we interpret as penile erection. Okay? Penile erection too can be called penile tumescence. That's the medical word for it. Okay, sometimes we could have that in the middle of the night, okay, or usually when we are waking up. Sometimes some of us can experience that. We refer to that one as nocturnal penile tumescence. Okay? Now, permit me to also say that the erection can actually be spontaneous. In some cases, it may not have to do with any form of stimulation, as we can see as we go into the topic. Now, what is erection? Penile erection is the inability of a man to achieve and sustain penile erection that will bring about sexual satisfaction to both the man as well as the spouse or the partner. We also said there is a complex interaction that involves psychological factors, that involve neural factors, by that I mean the nerves, that involves vascular factors, by that I mean the blood vessels, that also involve the endocrine factors, okay? Talking about hormones like testosterone, okay? Now, look at the picture we have on our screen. You can see the description I was trying to give. On either side, you can see the cavernosa, and below it, you can see the corpus spongiosum. The corpus cavernosa are two in number. They're cylindrically shaped tissue, dense fibrous tissue made of, usually it has the ability to expand. Okay? When blood gushes in, what happens is that it becomes firm, it becomes engorged, and then becomes enlarged. Ditto for the corpus spongiosum, but not as, it doesn't have the same degree of expansibility as the one on either side of it. Okay, so how does it present? I also want to say at this point that for us to make a diagnosis of erectile dysfunction, every man at one time or the other may have some form of erectile dysfunction. Oftentimes, it is temporary. Okay? It doesn't stay there for weeks. But when it becomes a problem that is becoming persistent, that is when we'll start talking about erectile dysfunction.
So if I hear you very well now, doctor, you are making us realize the fact that at times when we are laid back sexually, let me use that word, it's not something to cry to the doctor about. Maybe for a period of a week or two, it's not something to cry to the doctor about.
Yes, thank you very much, if I got you right, sir. Now, by that I understand it to mean that if you have this as one-off, or maybe once in a while, and then subsequent time that you go into the act, you're home and dry, that shouldn't be a source of concern. Okay. But when you have it on persistent and regular basis over weeks to months, okay, it should raise a cause for concern. Permit me to also point out that oftentimes it may be an indication of a coexisting or comorbidity or a problem, a medical condition that you may not even know of. Most of the time, it's actually a lead that enables us to discover that such an individual may be having some other chronic illnesses.
Maybe like heart-related issues.
Yes, heart conditions like diabetes too can give us such a picture,
yes.
as well as hypertension and dyslipidemia, cholesterol-related problems. Okay, now when someone presents with erectile dysfunction, the summary of all I'm trying to point out that it could be a pointer, an early pointer to an undiagnosed medical condition in such a patient.
Which, if reported early, could actually be
Of
changed.
course. And then, if you're able to tackle that underlying medical condition, oftentimes the problem resolves.
Where I come from, sir, we believe that, excuse me, where I come from, we believe that your inability to attain full sexual erection, or should I use organ erection now?
Yes, yes.
Full organ erection. We normally link it to jedi, which is bile. We believe excess sugar in the body is what causes this. And once you take agbo jedi, that's a bile concoction. And lo and behold, our fathers do it, and we'll see that somebody who takes agbo jedi now, in the next 10, 15 minutes, it will just stand, wow, and everything will... Does this have medical... Can this be medically proven, sir?
Yes.
And erection.
Yes, thank you for that. I've never thought, as you were asking the question, I just had another opening that I've never actually thought along that line. Okay? What you pointed at is not what we can just wave aside by the wave of the hand. No. It has so much meaning embedded into it. And of course, like you said, our forefathers were doing it and they were getting results. Just maybe, it may have something to do with diabetes. We all know that when you consume excessive sugar, especially when you're diabetic, it pushes your blood glucose level up. You become hyperglycemic. Okay? And when that happens, as a matter of fact, the major cause of erectile dysfunction are the factors that have to do with the vascular component, talking about the blood vessels. Okay, so what happens is that any medical condition that can actually reduce the degree of blood flow to the penile region or to the perineum or to the penis will actually affect, will actually cause erectile dysfunction. And of course, diabetes can do that in two ways. Diabetes can do that in that it can reduce the blood flow to the penis, and it can also cause damage to those very important nerves that permeate the penis, through which we actually get sensation. You can see some of the pictures that are being shown to us now. So you can actually do it in two ways. Number one, by reduction of blood flow to the penis, impeding blood flow to the penis, and number two, by damaging the nerves, okay, that surround the penis. So that may be what they were actually doing, and they were getting those results. Don't forget that some of those medicinal herbs,
okay,
though not proven, some of them we have seen claims that they can lower blood sugar.
Okay.
And of course, what we need to do is to actually subject all of those things to scientific analysis, okay, so that we could have them identified in proper form and perspective, so that we can make a kill out of it even as a nation. I can tell you that artesunate, that is today one of the mainstay or the major component of treatment of malaria now, was a Chinese herbs that they were using thousands of years ago. Okay, only to discover that these all-important herbs contain an artemisinin-based compound, which of course is the mainstay of treatment, because what we do today is what we refer to as ACT, artemisinin combination therapy. So I think we still need to look at some of those things. It's not something that one should just wave aside by the wave of hand.
Before you go into the full diagnosis of this erectile dysfunction, I would like to ask some questions that I feel are common, or let me say domestic questions, as it affects a man, most especially a youth, a man who is still highly juvenile. part of the problem men faces during sexual intercourse, which they shy away from asking most people. Some people feel maybe their penis is not long enough. Some might say it's short. So that actually catapults me to the next question, which says, is there a medically approved size or what the length of a man's sexual organ should be? Why? I have been in a bus before from Oshodi to Songo. You know these people that sell drugs. Yeah. I now, in the desperation to sell drugs, the man was now like, well, if your genital organ is short, there's medicine for it. And a man asked in the bus that, how do you know if it's short or long?
And the thing is now, it's all over social media where they tell you penis enlargement and all of that.
It's not even in terms of enlargement now, length. Not the length now. Now, the question now is, the man now said that, I don't know how true this is, but I know you are here to help us. The man said, when you fold a 1,000 naira note, this thing is not a laughing matter now. Said, well, it's our problem now. This is part of what is killing us.
No,
now,
not just our problem. I think I made the mistake
Doctor,
of saying it's men's problem alone. It affects the women.
It
affects them the more.
Now, the man said, when
you are
you
the
fold,
receiving end.
Yes, now, you are the one who push us. The man said, when you fold a 1,000 naira note and you place it beside your genital organ, that if it matches, if they are the same length, then you are okay. But if yours is shorter to the 1,000, you are, in terms of length now, you are having a short, you have a problem. So back to the question, is there a medically approved size or length of what a man's penis should be?
To attain sexual satisfaction, if I also will complete it with that.
You are right.
Okay.
Thank you, sir.
Now, thank you very much. We can't shy away from it. It's something we'll see and we hear very often. And then people talking about it and then people making the kill out of it. A lot of alternative remedies that they've been telling us, we see them every now and then, that this can do this can do that. But I'm here to actually let you know today that the satisfaction, the sexual satisfaction that a woman or a man derives from the act of sexual intercourse itself is not dependent on the size of the penis. Okay? Is not dependent on the size of the penis. Okay? But any man who has a normal sized penis should be able to have utmost sexual satisfaction.
I think that's the question. What's the normal size, sir?
There's actually no particular
US standard.
No. There's actually no approved. If I use the own words, approved or particular size. Okay, because I can tell you that even the ones that the man is talking about, those ones you think that are small, by the time they get erected, they do magic. Okay, so it's the ability of the individual to achieve good penile erection that actually matters. Okay. Because if you have one as big as whatever and it cannot function, it's as good as useless. Yes. So what is the point? Yeah. Of course, Limiti can bear me witness to that.
Doctor, I don't know what I say.
That it is not okay. So basically, what I'm trying to point out is that the satisfaction is not size dependent of the penile organ. It has to do with, number one, the degree of penile erection the man has, if he has good erection, and of course there are other forms of pleasures too that partners can actually explore other than this to actually attain the satisfaction
Doctor,
they want to have.
Like you said, it has a bit to do with women also. Now, what does the spine have to do with sexual, or let me say erectile dysfunction? Because now I don't get cases of people who get spinal cord injury, they still father children, and we've had cases of people that had the same spinal cord injury and they couldn't perform as a man.
In fact, most people suspiciously ask.
Yeah, so I don't know, does it differ? When it comes to spinal cord injury, does it differ?
Yes. Let me beg your pardon on this and hold the doctor a bit so that we'll go on this short break. We shall be right back. Go nowhere.
Health
matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show wey dey help people. Terms and conditions apply sha o.
For advert placement and sponsorship, make una call Stella Maris on top 070 3914 5229. Rebecca 070 6969 1950.
Erectile dysfunction or impotence is a condition wherein a man experiences inability to achieve and maintain an erection for a satisfying sexual experience. Erectile dysfunction commonly occurs in elderly people because the erectile capacity decreases with age. Erectile dysfunction may occur when the blood vessels going to the penis become blocked or narrowed. There is an interference with the nervous system that triggers erection, or when there is a reduced libido. Certain diseases may cause blockage or narrowing of the blood vessels, such as diabetes, hypertension, multiple sclerosis, nerve damage, hormonal imbalances, atherosclerosis, and heart diseases. Unhealthy lifestyle choices also predispose an individual to have erectile dysfunction. A person is more likely to develop erectile dysfunction if he is obese, alcoholic, smoking, or abusing drugs. Medications may also cause erectile dysfunction as its side effects, like with antihypertensives, antipsychotics, antidepressants, and tranquilizers. Psychological causes can play a part in the occurrence of erectile dysfunction. People suffering from stress, fear, gloom, uncertainties, sadness, or problems in the relationship can suffer from erectile dysfunction. Often, erectile dysfunction is caused by a combination of physical and psychological causes. A person who suffers from erectile dysfunction may experience symptoms that include difficulty getting an erection, inability to maintain an erection, and decreased libido or sexual desire. Lifestyle modification is the least invasive type of treatment for erectile dysfunction. Healthy lifestyle choices that can help relieve erectile dysfunction are to stop smoking, drink alcohol moderately, lose weight when you're overweight, stay away from substance abuse, and to be physically active. Erectile dysfunction caused by medication can be treated by replacing or cutting back the medication under guidance of a physician. Psychotherapy is used to treat erectile dysfunction caused by stress and anxiety. It is also important to talk with your partner about your complaints. Medications like phosphodiesterase inhibitors and testosterone can also be utilized. These medications can only be taken orally, injected directly to the penis, or inserted into the tip of the penis. Your general practitioner can give you more information about the disorder and its possible treatments.
Viewers, we welcome you back to Health Matta, and I should take note, say Slimy plus Dr. Bat, now then they engage yourself on the question. Where Slimy been fired Dr. Bat, that is what is spinal cord injury get to do with sexual performance. But before we answer that, it is pertinent we open the phone lines. As you take note, you and us now they do this show together. We know if you do them alone, a participatory show. Feel free, ask any question. Even you can refer to a friend, saying, my friend, get them, so that you can actually have your answer. No die in silence. Please ask anything where they disturb you as far as this question, they related. Dr. Bat, Slimy, phone lines from Dr. Bat first, then Slimy's question.
Okay, guys, the numbers are on the screen already. Just cue your volume as they try call us this morning. 081-054-3498, and of course 081-731-47589. Doctor, so I gave you 2 instances. I've had cases where somebody had a spinal cord injury and was still able to father children. And then I've had cases, had the injury for like a while now, and we're still expecting. So does it really differ, really?
Yeah, thank you very much for that very important question. I must point out that it's a medical question coming from our in-laws.
No, matron.
Yeah,
Matron.
thank you. Yeah, our
Matron.
matron. Yeah.
Matron.
Yeah. I was, by the way, truly and sincerely, injuries, not just to spinal cord, injuries to the perineum too, can actually cause erectile dysfunction. At the beginning, when we were talking about the complex interaction, we mentioned that it has to do with a number of factors, and one of which we said was neural factors, which has to do with nerve. So depending on the levels, spinal cord usually have Victor from Gombe.
Okay,
good
Victor.
morning.
Sorry, my dear.
Yeah, well done for the program, sir.
Thank you very much, Mr. Victor.
Yeah, the question this my chief asked from you, it seems you did not answer that question directly the way I expected.
Okay.
Yeah, the question was that, is there medication on enlargement, on this thing, what they call it now, how can I put it?
Penile enlargement.
Yeah. So the way you are saying the thing, I do not understand, because if there is health medicine that can be able to help or not, please, I just want to know.
Penile enlargement.
Thank you very much. Thank you very much. Truly, there are medicines that can actually bring about penile enlargement. There's also surgeries that can be done to achieve that. Recently, I think one billionaire actually lost his life in France when he went for such a surgery.
I think we took that on Kukuruku.
Yeah, I can't remember his name now and his country, but at least I know that he died in the course of trying to have a penile enlargement done. Everything is possible, my brother. Even breast enlargement too are possible. Okay, and any form of the any organ of the body can actually be enlarged.
Dr.
Do we have after effects?
What we are saying is that
Good.
what we are saying is that all of those things we see on the internet that they can do enlargement, they are not all facts. That's the aspect I actually want to point out. Okay, but if that is the goal that an individual desires, of course we have an aspect of medicine that deals with it. It's called urology. You can walk down, you can take a trip to go and see your urologist and tell the doctor, this is the goal I want to achieve. And of course, it can put you on the right path to go about it, so that you can't just resort to some of those alternative remedies that are at best ineffective, at worst can cause other complications when they're taken alongside other drugs. Okay? Thank you very much, sir.
Dr. Bat, to quickly compliment
we are still
question.
on. Okay, go ahead.
Oh, sorry. Please get done with that. Please.
Okay, so now these spinal cord injuries, like I said, we have Mohammed from
like
Jalingo.
Mohammed.
It's for you guys.
Good morning, Mohammed.
Because of you guys.
Good morning, sir.
Yeah,
How you
thank
doing,
you very
Mohammed?
much.
Well, thank you. How are you doing there?
We are
We are
fine.
good.
I have seen your wonderful, healthy programs that are helpful to we men.
Thank you very much, sir.
Yes, sir. So I also want to hear your advice on when somebody is having this problem,
What problem?
the erectile dysfunctioning.
Thank you very much, sir. Thank you very much, sir. We'll
get to that.
We'll get to that shortly. We shouldn't be in a rush, sir.
Don't worry, just keep watching.
We have all the time, we have all the weeks.
Yeah.
Thank you very much for your kind words. Okay, so talking about the spinal cord damage. Now, depending on the level of the injury, okay, usually we'll have spinal cord divided into section, okay. Depending on the level of the injury, where the injury occurred, that will determine the areas of the body that can be affected.
Okay.
So in all cases that you can actually have an outright loss of function of the genitalia, okay. Permit me to also point out that even when we do surgeries, it's just something similar that we do in surgeries. When we do surgeries like cesarean section and we're able to keep someone awake, have you thought of what we do? We inject, we put an injection.
Yes.
Stephen
From
men are
Taraba.
calling.
Steve, how you doing?
Yes, fine.
Yeah, good morning, sir.
My name is Stephen.
Yeah,
Stephen,
good
how are you
morning.
there? To your question, please.
My what? My question. Okay. Yes. It's fine. Stephen, give up. Fine.
Pile.
Yes.
Pile.
Fine.
Yeah.
Yes. If somebody says his weight, what type of medication will he take?
Okay. Is there a cure for pile medically?
Thank you very much, Stephen, for that question. I think he's asking for remedy for pie. Okay, but very quickly, I will just add one or two to what you need to know. Yes, there are medications that can be given if somebody has pie. The medical name for pie is called hemorrhoids. Okay. Now, one of the things we usually advise people to do, which you can do in the confines of your home, yes, I know I'm digressing, is to do what we refer to as seize bath. Okay.
Meaning, sir?
Seize bath is a situation where you boil water that you can tolerate and then put some salt inside it, and of course sit on it for between 30 to 40 minutes. You can do it first thing in the morning and last thing at night. It can actually help to relieve the pains before you can go and see your doctor for further evaluation and treatment.
Okay.
I hope I've been able to add something to that.
was-
Okay, so back to the question on spinal cord. And I said that the injection we usually give in the course of surgery produces such effects. So when you give injection at a certain area at the back, we call it lumbar anesthesia.
Okay.
What happens is that it makes
Paralyzes.
it paralyzes that aspect of the body. You realize that the woman cannot move the leg. The woman cannot move that aspect
part,
of the body. The lower down, you cannot move any part of your body there, but upper side, you can move your hands, you can move your head, because they were not.
Are you feeling
Those aspects of the
any
body
pains?
were not affected by such an injection. And but this will give you a temporary loss of functions. Also, the sphincters give way. Oftentimes when we finish surgery, discover that the woman has defecated, or the man or the woman may have defecated, even without knowing. Okay, so usually because they are on catheter, the urine keeps flowing. Okay, but that will abate after 4 to 6 hours. So that is something similar that happens with spinal cord injuries, and of course, depending on the level of affectation. Okay. But like I said at the beginning, not just spinal cord injuries, injuries that can occur to the perineum, especially in people who ride bike for a very long period of time. They could have pressure-related injuries to the perineum that can give you a temporary erectile dysfunction in some situations.
Okay, Dr. Bat, I watched that video distinctly, and I learned, and two things come my mind. First and foremost, from that video we watched, they say part of what they're responsible for why person if he gets erectile dysfunction na age. So we saw the picture of an aging man and stuff like that. What's your advice or what's your take on some men who are years above 70, 80 and they live or they use sexual motivational drugs? I don't want to mention name, but I know.
We have Shola from
Wow,
Lagos.
Shola.
Good morning, Shola.
Surely.
Good morning, sir.
Good morning, Shola.
Yes, sir.
Yeah, to your question, please.
I want to ask, yes, sir.
Yeah, go ahead, sir.
Can you turn down your TV volume?
I want to ask a question about gonorrhea and toilet infection.
Okay.
Okay, if you affect. True.
Okay, so what's the question about them?
I want to ask a question about
Shola, are you there?
We're expecting you to turn down your TV volume, but I'm sure he's trying to ask if you affect.
Vis-a-vis,
Yes.
erectile
Okay, so
dysfunction.
yes, thank you very much. His problem was on gonorrhea and toilet infection. I think we have said that before in this forum, that there's actually nothing like toilet infection, but it's a coinage that people at least are at liberty to use, if I want to use that word. Okay, so but that said, gonorrhea is a form of STI, sexually transmitted disease. Okay, can it cause erectile dysfunction? Yes, infections have been implicated in the cause of erectile dysfunction, especially when they are not treated. Not just erectile dysfunction, they can also cause infertility. Okay, that's one it will cause more. It will also cause infertility. But that said, I want us to look at the video that we watched. Okay, they mentioned a number of causes, but I want us to look at the causes by looking at the factors, okay, that actually are involved in the normal process of penile erection. Okay, at the beginning I said that it has to do with the vascular component. Okay, under the vascular component, talking about blood vessels, there are a number of causes. They seem to be the major ones. Under it, you have hypertension, you have diabetes, you have dyslipidemia, cholesterol-related problems, you have atherosclerosis. Okay, these are things that can bring about the reduction of blood flow to the penis. Okay, and can also cause damage to the nerves. But that will come under neural component. Under neural component, you have causes that affects the nerves. Top on the list is a condition that we refer to as MS, multiple sclerosis, Parkinson's disease. Okay, these are some of the things that can bring about. Well, I'm going to something that are highfalutin. What about diabetes? It can cause nerve damage. So the neural components will involve causes that will affect the nerves, that will cause nerve damage. Oftentimes, you can see that happening in people who have undergone pelvic surgeries. Talking about people who did surgeries like prostatectomy, surgery for prostate enlargement. In the course of the surgery, some important nerves that actually subsist such functions can equally be affected. So you have causes along that line. We have Stephen again from Taraba.
Wow, Stephen is back. Stephen, good morning once again.
Morning. How are you?
I'm fine, sir.
Yes, sir. The question I asked, I'm not satisfied with the answer you gave me.
Okay, come again, sir. The treatment, you were the one that asked after the treatment, sir.
I said that I didn't satisfy with the answer you gave me.
Okay, sorry about that. Let's have the question, sir.
I said I'm not having pile. I'm not a diabetic patient. But what if somebody erection is weak? What will be the effect?
I think I get him.
Okay. He doesn't have
He doesn't have
diabetes,
he doesn't have
but he has
diabetes,
erectile dysfunction.
His erection is weak.
Oh, okay, thank you very much, sir. What I will advise you do, we are looking at the causes, things that can cause erectile dysfunction. It's not only pie, it's not only, and of course, we didn't get to know your age as well, okay? So if you may have cholesterol-related problems without knowing. You may have atherosclerosis without knowing. These are some of the things that can bring about reduction of blood flow to the penis, and of course, they can lead to erectile dysfunction. But what my advice to you is, please ensure that you go to hospital and see your doctor. Make this, present these complaints to your doctor. I'm sure they will know what to do. If need be, a urologist will be of help so that you can be properly evaluated. I must be honest with you, it's not all the causes that will be able to reel out on this program, okay? There may be some that we may miss out. The causes are enormous. There are so many, okay? Sorry if we didn't answer the question very well the initial time. I think apparently we didn't get the question right. So we're answering another thing while you were hoping to hear from other thing. But take away from me this morning is go and see your doctor for proper evaluation so that they can identify whatever be the cause in your own case. Because what may be causing yours may not be what will be causing another person's own. There are two major causes. There are the psychological causes and there are the physiological causes. At the moment, we are dealing with the physiological causes, and we mentioned that the ones that have to do with vascular, the ones that have to do with nerve. We are going to also talk about the ones that have to do with
neural.
Yeah, neural, the nerves. With the endocrine functions, the one that has to do with hormone. Okay, so like we saw in that video, hormonal imbalance too can be a cause of erectile dysfunction.
Of glands.
Yes, so sometimes when somebody is having erectile dysfunction, one of the tests that the person may be asked to do is to do a hormonal assay. Okay, so
hormonal assay.
Yes, assay. Now, because what brings about in the course of having an erection, we have Tayo from Ilori.
Tayo, good morning, sir.
Good morning, sir.
How are you doing, sir?
Can you turn down your TV volume, Tayo?
Your volume is high.
Kill the volume.
Good morning, sir.
Yeah, good morning, my
Because
brother.
delay with that.
I'm doing good, sir.
Okay, feel free to ask your
To
question.
your question, please.
My question is that for somebody that smokes,
That smokes, okay.
what can the person do? The person will not be affected with this erectile dysfunction.
Thank you very much. Thank you very much, my brother.
What can the person do for it not to be affected?
The person needs to stop smoking, sir.
Erectile dysfunction.
The person needs to stop smoking. Okay, so now that he has mentioned that, it's nice to also talk along that line. Okay, so unhealthy lifestyle practices can actually cause erectile dysfunction. Okay, number one, if you allow yourself to become obesity, you could have that as a challenge. If you allow yourself to lead a sedentary lifestyle, remaining in a place, not being active, you can actually get into that problem. Smoking, excessive intake of alcohol, that can cause that. Drug and substance abuse, that can cause that as well. One of the risk factors that Chief mentioned that we didn't get to tackle because the questions were coming in fast.
Because I have one I must ask before we go, and I won't let you go unless I ask.
Is age related? Permit me to point out that age on its own. Okay, let me take it this way. As we advance in age, just like we saw in that video, people who are at their 40s, 40% of them will have challenges with erectile dysfunction. People who are at 70, about 70% of them will have problem with erectile dysfunction. It does not mean that erectile dysfunction cannot occur at any age. It can actually occur at any age, but with age, of course, the body picks up a lot of baggages as we are getting older. Hypertension may not be there at our much younger age, but by the time we are getting older, it shows up. Diabetes may not be there at early age, it shows up. Cholesterol problems may not be there at early age, it shows up. On and on like that. So I must say that it's a long
okay, because we don't have the luxury of time. I think there are a lot of questions I would have loved to ask you, but we really need to go now. I have to say thank you to you, Dr. Bat, for this wonderful PCC of the topic. But next week we have to. It's just starting.
So go nowhere. We'll be back next week.
Especially for those waiting for the what can you do? Don't worry, just chill. I'll see you guys 1 to 2 anyway.
Yeah, thank you very much.
Thank you very much. Stay cool. Join the tea 1 to 2. Bye.